welcome to the Truth Be Told podcast. My name is Erica, and this is Brandy.
Hello, everybody.
Hey, back for another episode. So
Yes,
this
ma'am.
episode today is about dental jargon versus dental slang. Dental
Mhm.
slang. So basically, what if you don't know what jargon is? And let me quickly say, if you're new to our podcast, first, welcome. Second, our podcast is focused on helping the underserved and the underprivileged, especially and particularly people of color, Black and Brown people, with their healthcare experience in terms of dental. Okay?
Yes.
All right.
Mhm.
All right. So back to what I was saying. So,
Yes.
definition of jargon
Okay.
is special words or expressions that are used by a particular profession or group and are difficult for others to understand. Okay. So, dental
Mm-hmm.
jargon is what Brandy uses in her profession, her dental profession as a hygienist, and everybody else, dentists and everybody else, dental assistants.
Yes.
And
Mm-hmm.
then
All of us.
yeah, all of them. All of them. And then the slang, like people like myself, where we say one thing because that's what we might have seen on TV or in a television show or whatever. You heard it
Mhm.
somewhere somehow. So she's going to explain to us what is the real deal. What is that? What we think it is and what they say it is. Okay.
Yes.
Okay.
So perfect, Erica. I'm glad that you gave like the actual definition of jargon. Because sometimes we just take for granted that, people know what we're talking about. But yes, so dental jargon is probably like those are the terms we're going to use in the dental profession. And a lot of times when I talk to patients, I usually try to bring everything down to the patient level because I know the terms can be really difficult to understand. So I got a bunch of terms, but Erica, is there any one in particular that you have a question about or you want to know what the dental term is? Anything you thinking about?
Okay, a couple of times because we have tons of information that Brandy gives me, and I read through it, right?
Uh,
Because that's what we base the show on, right? We go through. You
yeah.
have so much content, and we focus on that, and then that's how we pick out what our episodes are going to be about. So a couple of times I read through the content, and I said, "What is this?" So deciduous, right? Because you
Mhm.
had wrote that down, and I'm like, I don't know what this is. What does this mean?
So basically, deciduous teeth are baby teeth or primary teeth. So those are teeth that you are going to lose as a child teeth. So there's some adult teeth that do not have baby teeth above them.
Like wisdom teeth?
Like, so wisdom teeth or any molar. So any molar,
Okay.
first molar, second
Oh
molar,
yeah.
wisdom tooth, they don't have baby teeth above them. Just the canines or the cuspids, the premolars, and the incisors, which are the front teeth.
Okay.
Those are called succedaneous teeth because they have teeth succeed them. So, shut up. You're like, okay, that's enough. But they're called succedaneous teeth. Any teeth that have a tooth coming behind them. So all the baby teeth that have teeth coming behind them, those are the succedaneous teeth.
Okay, so that's a 5-letter word. I mean, $5 word, whatever, $10 word.
Wow. I was about to say, hold up, because that's
No, it's
quite a
big.
long
It's big. It's big. It's like $20. It's a $20 word. Succedaneous. So I'm thinking suck second. Like, is that
right. So the adult teeth,
okay?
so the permanent incisors, which are the front teeth, the permanent canines, and the permanent premolars. Those are all succedaneous teeth. Those are teeth that succeed baby teeth, so come up behind. So that's why you said second,
Mm-hmm.
succeed, succedaneous. So the molars are not because they're not following anything. They're coming in on their own.
Mm-hmm.
There's no baby teeth. So
Okay.
deciduous, they're baby teeth. Succedaneous teeth are permanent teeth that come up behind baby teeth.
Okay. So when you're
Okay.
in the chair, you guys are saying that to each other, and of course
Sometimes we're talking to each other and patients
right.
hear and they like, oh, what they talking about. So
Yeah, like what's that mean? If somebody says succedaneous, I'll be like, what?
It
What's that?
sounds interesting, right? Like, what could that possibly
It
mean?
sounds like, is there something wrong with my teeth? Like,
It
sucks
does.
to do.
It's such an extra word. Like, who thought of
It
that?
is. It's so
Spontaneous.
sick.
Like, you're real extra with it.
Yeah.
And it's like
Oh,
12 letter, like the whole word is so long.
yeah. Like
Too.
what? Succedaneous. Okay.
Okay. So
It
what
kind
else?
of sounds operatory.
Oh, operatory. So operatory
Operatory.
is just the dental room. Ooh, child, just the room that what happened? That was
You
so
felt
I
your
had this
thing, your
earring. I was
earbud.
upset because I was about to be like, I know this earring ain't fall out because you know how I feel
No.
about the earring. Um, real mad about that. Okay, just
Okay.
this. Okay, second. Um, so operatory. Okay, that's the dental room, the treatment room, where you get your fillings, where you get your cleanings. You might hear us say that. I say it all the time, and it's just like a regular thing. And I've had like I remember Christian was like, "What's operatory?" And you're like, "What's operatory?"
I said that to you too. I was like, what is that? There was another word, and for the life of me, I cannot find it. And I remember asking you, I was like, what does that mean? But
I'm not sure.
I'll come back to that in
Yeah,
another episode, I
let it
guess,
marinate. Let it
if I
marinate.
can't figure it out. But I mean, you guys do use a lot of big words, and that's a lot of,
It
and
is.
then yeah, it's like that's a
It could
lot
be
of
it could be extra. Like with everything else going on, it can be extra. So listen, y'all take notes, replay the video, write it down. That way you have an idea. I mean, information is easy to find, but we're putting it right here for y'all. So all right, so how about what is a crown? Some people come in and they're like, "Oh, I need to get this." You were like, "You need to have a crown." What's a crown? A crown is what, Erica?
it. So I have a crown. Well, I think it's a crown or a
What else
cat
would you
or a
call it?
cap or a cap, right?
Yes.
Okay.
So a cap is the same thing as a
Yeah.
crown. So we usually say crown. You know, laymen they usually say cap. That's like
Okay.
the everyday individual. And
Okay.
then we have if you have your gums are having issues, we say your gingiva is having issues. So you're having gingiva versus gums, right? And
Wow, I did not know that one. No, seriously. I mean, I know about gingivitis, but I never knew
so
about
now that you
ginger.
know that gingiva is the same thing as gums, gingivitis has to be what? Inflammation of the gums
Yeah.
or
Mm-hmm.
early gum disease. So that's what gingivitis is. Gingiva is gums. Gums are inflamed. That's gingivitis. So it's also known as early gum disease or gum inflammation.
Okay.
Um, Now, if you have periodontitis, or if you have periodontal disease, we call that advanced gum disease. So that's a disease that attacks the
Mm.
tissues and bone that hold the teeth in place. So once you have a disease that attacks those tissues and those
Mm.
bones and they start to recede away, you have nothing to hold the teeth in place. The teeth become loose, they become non functional, and you can no longer use them whether you have cavities or not. You can lose those teeth. So that's what periodontitis, periodontal disease is. It's advanced gum disease. It is irreversible, just so you know. Can't go back from that once you have it. What else we got, Erica? Anything? Okay, I have
Um.
restoration. So sometimes we'll be like, oh, this person needs restorative treatment. They need a restoration. Basically, a restoration is any kind of dental work, a filling, a crown, bridge
Mhm.
work. If you're having a root canal, it's just restorative means repairing what's there.
To
So
restore it back
restorative
to
treatment, trying to restore
yeah.
it back to,
Mm.
it's never going to be original, but
No,
as best as we
it's
can,
not.
right?
Yeah.
Um,
What
I
else?
have. Let me see what else I have here on the list. Oh, I
Mm.
have a bonding. A lot of people come in and be like, "Oh, I need a bonding." The
What
doctor said
is
I need a
that?
bonding.
What
A
is
bonding is
that?
just a filling, so it's real extra. And I hate people come in like, I have a bonding," like it's something extra, and it's just a filling mainly on the front teeth. So a tooth colored filling put on the front teeth. So you would never do a
Mm-mm.
silver filling on the front teeth. People that have silver fillings, they are also known as amalgam fillings. Amalgam being a type of metal that's
Aren't
used. It's used less and less, but still some that
yeah. they're trying to do the whites, right? What's the whites? What's that mean?
That's the
What's the
composite filling. So a
okay?
white,
I'm like the white
a,
filler.
a composite restoration is a white or tooth colored filling. And
Okay.
that's what that is. So that's what they
Okay.
possibly do. So composite restoration is a tooth colored filling. The amalgam restoration is the silver colored filling. So you
Okay.
got those two.
All right. So
Okay.
let's do like a couple more before we're out of here.
Yes. So let me read then, because I'm gonna read it out.
Okay.
I'm
Go
gonna read
ahead.
them
Go ahead.
out.
Go ahead.
So we got calculus versus tartar. Okay, calculus versus tartar. You
Mm-hmm.
have I think we actually said it. Oh, if you're getting braces, you're also going to have orthodontics. So for orthodontics, you're going to have braces. For a scaling and root planing, you're going to get a deep cleaning. So we got scaling, root planing, deep cleaning. Prosthodontics, that's the dentistry that focuses on crown and bridge work. Endodontics is
Mm.
dentistry focused on root canal treatment. Periodontics is dentistry focused on gum treatment. And oral maxillofacial surgeon is a oral surgeon. So somebody who's going to do extractions, TMJ issues, oral
What is
surgery.
TMJ?
It's a temporal mandibular joint. It's a joint that
Mm-hmm.
hinges your jaw here.
Mm-hmm.
That's
Okay.
what TMJ is.
Okay.
TMD is temporal mandibular disorder. So just so you guys know,
Okay. I've
TMJ.
heard of
Everybody
TMJ,
has
but
TMJ. It's a joint.
okay.
That's all it
Okay.
is.
Okay.
Um, and then we have decay equals Erica.
Okay, DK equals black. I don't so
Okay, well I hate not that. I'm gonna say cavity, so that's a decay.
Oh, okay. I'm thinking. Wait. It's plaque. That's black. That's plaque. Plaque is black, right?
Not necessarily. It's
No, it's
actually not.
not.
No, it don't have to
What?
be.
Okay, tartar. What?
So that can be, but it's not
Oh,
always.
okay.
But decay just means cavity. So
Okay.
if you hear somebody say tooth decay, they're talking about cavity. Or caries, carious lesion, caries or carious
Mm-hmm.
lesion is a cavity. If you got a plate, what you wearing, Erica? If you got a plate, if somebody got a plate, what they got?
It's like that's like more like a okay. Hold up. See, this is
Listen,
like
I'm putting you on the spot.
no, you are. I'm like, wait a minute.
On the clip.
I just saw this too. So please bear with me, people.
Listen, I'm just trying to give
All
you a
right.
tip.
Okay. Plate. So it's not has nothing to do with caps or crowns, right?
You tell me. What do you think it
Okay.
is?
I'm asking.
You want me to give you the answer?
Give me three choices. Give me
All
three
right, it's
choices.
something you wear.
It's something you wear
Mm-hmm.
in your mouth, though, right?
Well, this is a dental
Wait.
podcast, madam.
Well, it's not a retainer, right? Is it a
No,
retainer?
but close to it.
Okay, it's not braces. Is it dentures?
Yes. So
Okay. Oh my God.
people will say, "Oh, my plate doesn't fit." So it's either a full denture, which is a denture that replaces all your teeth, top or bottom arch, or a partial denture, something that clips onto your existing teeth to fill in missing teeth.
Okay.
They can be metal, they can be plastic or acrylic. But a lot of times people will say, "Oh, my plate doesn't fit or my plate isn't working." That's a full or partial denture. What about
Listen.
local anesthesia? Do we know what local anesthesia is?
Putting you under and the operatory in the office.
Okay, hold on. Wait a minute. That's hilarious. You got in the operatory. That's what you get. Okay, local anesthesia is when you get numb. So it's the
Novocaine.
injection stick.
Novocaine.
So no one uses. Okay, I'm glad you brought that up. So quickly, Novocaine has not been used since the 1960s, but everybody says Novocaine. So it's lidocaine is one of the main things. There's a bunch of ones: Marcaine, bupivacaine. Those are the same thing. Articaine, but mostly dentists are using lidocaine. No
Okay.
more Novocaine. I still say that to my patients because that's what everybody. I let them know I'm going to get you
Girl,
Novocaine. But
who knew?
so local anesthesia, yes, lidocaine. Okay.
Okay.
So, and lastly, quickly, so third molars are wisdom teeth. The canine or the eye teeth, those are your cuspids. Your four front teeth up top, your four front teeth on the bottom, those are incisors.
Mm-hmm.
A pulpotomy is a baby root canal. If you ever hear somebody say pulp or pulpotomy, And then I
Now what?
think I went the rest of these. I think I did. Oh, Erica, you asked me one thing I wanted to answer. You asked about the
Mhm.
stainless steel crown, right? The metal crown.
Yes, I did.
Okay. So the metal crown stainless steel is typically placed on baby teeth. And
Mm-hmm.
yes, they will come out eventually. But the reason why we restore or we fix baby teeth is because they
Mm-hmm.
hold the space for the permanent teeth to come up so that they don't come in haphazardly. So if your kids are having issues with teeth, fix them. Don't just pull them out. And no good dentist will say just pull them out unless they're almost ready to fall out. If they're about to fall out, it's okay. But if
Okay.
they're going to have them for another year or so, they need to stay there so that the adult tooth has a channel to come through. If that makes any sense.
Okay, girlfriend. You on it. You on your stuff.
On and on like
Okay.
popcorn. Okay.
Yes.
Well, if I think of any more terms, I'll slip them in
Okay.
here and there in
Yes.
episodes. But I think that's good for now. Unless you had something else, Erica.
I think that's it. You gave me a lot of information. You definitely you gave us, everybody, not just me. All of
Listen, all
our
in the days
oh
as a
yes.
dental health educator.
Yes. You
I
gave
am,
me a
but you know what I'm saying.
yeah. You gave me a lot. You tested me. It was like Jeopardy.
It's like a little Jeopardy esque.
All
All
righty.
right.
So thank you so much, everyone, as always, for joining us. I hope you've learned a lot, just like myself. And tune in next time.
Yes, please follow, share, subscribe, like. Send questions
Yes.
to our Gmail, which is toothbetoldpodcast@gmail.com. If you guys
Mhm.
have any questions or want to see anything, just let us know.
Yep. All right. Until next time.
All right, take care.
Bye.